Medicos. So good day to all of you, and today I will be starting with a new region, the head and the neck. Now, in the introductory class to the head and neck, mainly we will be just discussing about the short introduction of the head and neck, its skeletal framework, what are the bones forming the skeleton of the head as well as the neck region, then some basic remarks about the neck, followed by that mainly we will be discussing about the normas of the skull. Then in brief I will be discussing about the mandible, and finally some basic aspects about the neonatal skull. Now, we all know that the head is actually the uppermost part of the body. Okay, and not only that, so whenever we think of head, what comes to our mind is the brain. So the brain is actually present inside a protective covering, that is the skull. Okay, so the skull can also be called as the brain box. Okay, not only that, outside the skull, external aspect of the skull, you have all the soft tissues of the head, the muscles, the fascia, the vessels and the nerves. So are all present around the skull, and inside the skull we have the brain, which is the highest seat of control. So our whole body is actually controlled by the brain, the nervous tissue which is present inside. So we are now able to understand how important the skull is. So which forms the skeletal framework of the head. So the head is mainly formed by the skull, or you can also tell not only mainly formed, it is only formed by the skull. And this head, the weight of the head, skull with the brain inside and all the soft structures rests on the neck. So the neck is mainly involved in the weight bearing. Okay. And the only joint between the skull or the head and the neck is a single joint, that is the atlanto-occipital joint. Okay. Now because of this only single joint where the skull articulates with the upper part of the neck, our head is freely movable. So we can bend our neck forwards, or we can bend our neck backwards, or we can bend our neck sideways, and not only that, we can 360 degrees we cannot rotate our head, but up to 180 degrees you can rotate. Okay, so thereby you can rotate and see sideways, and this is all possible because of the single joint. So if there are multiple joints between the head and neck, what happens is then the movement of the head will be restricted. Okay, so these movements are all possible because of the single joint. Now, we all know that the skeletal framework of the head is mainly formed by the skull, and the skull can be broadly classified into two parts. One is the neurocranium and other one is the viscerocranium. Okay, total put together the neurocranium and the viscerocranium comprises of 22 bones. So neurocranium is which encloses your brain and mainly forms the wall of the upper part of the skull. So like a lid or a covering, that mainly forms the neurocranium, and the neurocranium is mainly formed by the 8 of the 22 bones. Okay, so 8 bones are responsible for forming your neurocranium, the part of the skull which encloses your brain. Okay, So these 8 bones, there are both paired bones as well as the unpaired bones. The paired bones mainly is the parietal bones you see on the either side and the temporal bones. Okay, so a pair of parietal bones and a pair of temporal bones, so 4 bones. The remaining 4 bones are your frontal bone, the single frontal bone in the front, an occipital bone behind, then you have the sphenoid bone on either side. Okay, so don't think this part of the sphenoid bone on either side, it is 2 bones. Only one sphenoid bone is present in the center. This part which you are looking at the sides is the greater wing of the sphenoid. So on either side you have the wings of the sphenoid, the greater wing of the sphenoid. So it is actually a one bone. It is a part of the sphenoid bone which you are seeing on the either side. So left and the right wing of the sphenoid. So that forms, and one more bone is the ethamoid bone, which you see to the nasal cavity. You look, then you can actually appreciate the ethamoid bone. Okay, so these are the bones forming the neurocranium. A pair of parietal bones, a pair of temporal bones, and an unpaired frontal, occipital, sphenoid, and the ethamoid bone. Now, the upper part where you are able to see this is actually called as the calvaria, or the vault of the skull. Okay, the vault of the skull, the calvaria, mainly you see the frontal, parietal, and occipital, and the part of temporal bones you are also able to see. They are mainly flat bones. Okay, so wherever you come across flat bones, their main function is protective in nature. For example, if you look at the ribs, they protect the thoracic cage, so they are an example of flat bones. Sternum is an example of flat bones. Okay, same way the hip bones, even though they are considered as irregular bone, the ilium is an example of flat bones. And here these flat bones, they are membranous in ossification. So the vault of the skull is actually ossified by membranous type, the calvaria or the vault of the skull. Okay. Now if you look at the bones of the vault of the skull, you are able to see an inner table of bone. Then you are also able to see an outer table of the bone. And in between these two, you see with numerous pores a vascular structure which is actually called as the diplo of the skull. So you also see blood vessels in this diplo. They are also called as the diploid veins. Right? These spaces are not found everywhere. The frontal bone you can see, because frontal bone is again an example of pneumatic bones. Frontal is an example of pneumatic bone. Maxilla again is an example of pneumatic bone. Ethamoid and sphenoid are also examples of pneumatic bone because they contain air-filled spaces. So here you are able to see the frontal sinus. Okay, so infection of the sinus only, it is called as sinusitis. So you have an inner table, outer table. Inner table again will be lined by endosteum, so which is a modification of the dura mater. Whereas the outer surface, outer table of the bone will be lined by the periosteum. So periosteum, so throughout the body, all the bones are actually covered by the periosteum. Only certain bones lack the periosteum, like your sesamoid bones, they actually lack the periosteum. Okay. So the vault, as I told you, lined by periosteum and the endosteum. So the bones, vault of the skull, when they are actually purely membranous in type, when you look at the bones at the base or the inferior part of the skull, they are partly by membranous and partly by the endochondral. So the same bone A single bone, what happens? Part of it may be endochondral in ossification and part of it may be membranous in ossification. One good example is your occipital bone. So, occipital bone is partly by membranous and partly by the endochondral ossification, because it forms both the vault of the skull as well as the base of the skull. Now, coming to the bones of the facial skeleton, it is also called as viscerocranium or splanocranium. Okay. Why it is called as viscerocranium or splanocranium? Because mainly it is developed from the branchial apparatus. So, developmentally these bones are from the pharyngeal or the branchial apparatus. So, they are actually called as the viscerocranium and splanocranium. Not only during their formation, the neural crest cells are also incorporated. So, that is how the face, the bones of the face and all the other structures which you see are developed, like your tongue, tonsils, all those things and structures in the neck are all mainly developed from the branchial apparatus, where their neural crest cells are also incorporated. Okay. The bones of their face, mainly they are actually 14 bones, you can see. So, plus you also see 3 ear ossicles which is present inside the middle ear, that is the malleus, incus and scale. So, excluding these 3 ear ossicles, you have 14 bones which forms the facial skeleton. Again, you have both paired bones as well as the unpaired bones. So, you have a pair of maxilla on either side. Then these zygomatic bones you are able to see here, the pair of maxilla, pair of zygomatic bones, pair of basal bones, and at the medial wall of the orbit you can see the lacrimal bone, and you are able to see one projection inside the nasal cavity. So, that is the inferior nasal concha. Okay, that is inferior nasal concha. So, 6 bones, since they are paired, actually forms the 12 bones. Okay. So, mainly what you see is the pair of maxilla, pair of zygomatic bones, then you see pair of nasal bones, pair of lacrimal bones, and then the what you see here is the inferior nasal concha. Actually, there are 3 conchas which are projecting from the lateral wall of the nose or the nasal cavity: superior, middle and inferior concha. Superior is not seen here, middle you can see, and inferior. Superior and middle are actually parts of the ethamoid bone, whereas the inferior nasal concha is an individual bone. Okay. Now, unpaired bones, mainly your mandible. So, it's a single bone, but developmentally again 2 halves are actually fused in the midline. Mainly you are able to see that is an unpaired bone, the mandible which forms the lower jaw, maxilla which forms the upper jaw. Then in the midline you have one bone which forms the nasal septum, that is the vomer. So, the vomer is again a single bone in the midline. It is an unpaired bone. Okay. Now, the whole skull we have seen the neurocranium and the viscerocranium. So, of the skull, the only movable part is the mandible or the lower jaw, and that again articulates with the skull, that is through the temporal fossa forming the temporomandibular joint. Okay. So, you have an articular fossa in the temporal bone which forms the temporomandibular joint, the only mobile or the movable part of the skull. And again, both the joints move only as a single unit. You cannot move separately temporomandibular joint of one side and the temporomandibular joint of the other side. Now, apart from that, you also come across sutural bones. So, in between the sutures, so these are actually called as the sutures of the skull. There are different types of sutures. They might be of the squamous type or dentate type. So, these sutures are held together by the sutural ligaments. Okay, the sutural ligaments are present, and then along the sutures you can see there is a continuity between the periosteum and the endosteum, the outer and inner lining of the mainly the calvaria of the skull. So they mainly contain sutural ligaments, and in between you see sutural bones. Okay. So these sutures are joints, but they are completely movable. They are plain fibrous joints. So the fibers which are holding these sutures together is the, as I told you, the ligaments, the sutural ligaments. Now let us try to just understand certain basic features of the neck. So it helps to hold the head in its place. So mainly it is involved in weight bearing and attached to the trunk by the root. So this is actually called the root of the neck. The commencement of the neck is actually called as the root of the neck. So through the root of the neck, what happens is most of the blood vessels, they enter or leave the neck from the thorax to the neck or from the neck to the thorax. Okay. Then blood vessels, not only that, the most of the nerves, so especially the brachial plexus, you see that from the neck they go to the upper lip as they pass through the root of the neck. So mainly you are able to see the soft tissues of the neck. They are made up of the muscles. Then you have the major vessels. Then you have the nerves. Okay, and apart from that, you also have the upper part of your gastrointestinal tract, the GIT uppermost part. Okay, and then the respiratory system, upper respiratory tract is also present in the neck. Then of course you have the thyroid gland and the parathyroid gland also. One of the important endocrine organ is also present in the neck region. Now mainly you can see the most of the muscles, your sternocleidomastoid or trapezius. Then you have so many muscles which is situated in front and the sides and behind the vertebral column. Prevertebral muscles, paravertebral muscles are all present. They actually, what happens is they render support. Thereby what happens is they anchor to help the head to stay in its place. So thereby what happens is they support the weight of the head, and they are also involved in the movement of the head. So the various movement of the head, side to side movement or the lateral movement or your nodding movement. So all these things are rendered by the muscles which anchor or pass from the head to the neck or from the neck to the head. Okay. So as I told you, the major blood vessels and nerves are all present. It also lodges the upper part of your respiratory tract. So that is your larynx and the trachea, and behind that you see the esophagus, the upper part of your GIT. And then clasping the upper part of the trachea is your thyroid gland, and behind the thyroid gland you see the parathyroid glands are also present. Now coming to the skeleton of the neck, it is mainly formed by the cervical vertebra. So the cervical vertebra are actually individual 7 cervical vertebra which are arranged one on top of the other. So it is mainly made up of the cervical vertebra, and they show a flexure, okay, an anterior flexure or bend. This is actually, or you call it as a curvature. This is a secondary curvature, not present during the birth. This curvature develops only after the 3rd month, when the child tries to lift its head, and then due to the weight bearing, slowly what happens is the curvature develops. That is the secondary curvature, the cervical curvature, which is present in the neck, and it is convex anteriorly. So the other skeletal elements apart from the 7 cervical vertebrae, you see a hyoid bone. It is very difficult to palpate the hyoid bone because it is completely surrounded by muscles, and it does not form any joint. It is just suspended by the muscles and the ligament. Then apart from that, if you want to strictly consider about skeletal elements, so whether it is bones or cartilages, then definitely we have to include these cartilages, mainly the cartilages of the larynx, the thyroid cartilage, the cricoid cartilage, and very small cartilages of the larynx such as the arytenoid corniculate, cuneiform cartilages are all present. Then of course cartilages are also there in the upper part of the trachea, the C-shaped cartilages rings. So all these can also be considered under the skeletal aspect. Okay, and of course the upper part of the respiratory tract, that is your laryngeal cartilages, they are also serve the purpose of voice production, the laryngeum or the voice box, the larynx or the voice box. Okay, so as I told you, the neck in the beginning itself, while the face, the cranium, it is developed from the branchial apparatus. The major blood vessels of the neck, arteries, you come across carotid system of arteries. Okay, so the carotid system of arteries, mainly you see here is the common carotid artery dividing into external and internal carotid arteries. So the external carotid arteries supplies the external part of the skull, face, muscles, fascia, all those things in the neck and the face, and also the scalp, the soft tissue on top of the skull. The internal carotid artery enters deep inside the skull and supplies the structures, mainly your brain, okay, and then your eyeball, and also the structures in the orbit. It is mainly supplied by the carotid system of arteries, that is the external carotid arteries and the internal carotid arteries. Apart from that, other structures, other blood vessels are branches from the subclavian artery, one of the major arteries, the vertebral artery. So this also supplies mainly your structures inside the skull, again to the brain, posterior half of the brain it mainly supplies and connects with the carotid system of arteries, the vertebral arteries. Then other branches of the subclavian artery are also involved in supplying some of the structures in the neck, mainly from the thyrocervical trunk they give certain branches. Veins, again it is mainly two major veins you see here, the external jugular vein and the internal jugular vein. So the internal jugular vein mainly drains blood from the interior of the skull. So inside the skull or interior of the skull, we don't have any vascular trunk, you don't have a tubular structures, but instead it is present in the form of venous sinuses. Okay, so you have venous sinuses which are present. So that we will be discussing in the later classes, what is venous sinus and how it differs from the blood vessel. But already I have spoken about this, what is the difference between a blood vessel and venous sinus in my general anatomy classes. So please refer to my topics on general anatomy series, circulatory system, in that I have explained in detail about that. Okay, so mainly you see the internal jugular vein which drains blood from interior of the skull and external jugular vein. Okay, so external jugular vein mainly drains the blood from the scalp, then from the face and from the neck region. Okay, then nerves, the head and neck region is mainly supplied by the cranial nerves. So I need not list all these nerves, you would have been aware of the names of these nerves in your intermediate school level itself, the 12 pairs of the cranial nerves. So they are responsible for innervating all the structures of your eye, nose, tongue, your sense organs, ear and all those things, and all the soft tissue structures of the head and the neck. And apart from that, structures in the neck and also behind the scalp is also innervated by the branches from the cervical plexus. So you have cervical nerves from there arising from the cervical segments of the spinal cord, they form plexus, and through that they give certain nerves or branches which will innervate the skin and some of the muscles of the neck and also part of the scalp region. Then the parasympathetic component is mainly taken care of by the peripheral parasympathetic ganglia. 4 ganglia are there and they are mainly functionally related to these 3 cranial nerves. Okay, That is the third, seventh and the ninth cranial nerve. Oculomotor, your facial and the glossopharyngeal nerve, parasympathetic. Sympathetics is from the sympathetic chain, cervical sympathetic chain which you come across in the neck. We have ganglia in between them, superior, middle and inferior cervical ganglia. Okay, so fibers from there they arise and they travel along with the blood vessels and they innervate the structures outside the skull as well as the interior of the skull. So that is the sympathetic and the parasympathetic part of the head and the neck. Okay. So with this introduction about the structures, a short introduction about the head and neck and how the structures are arranged in the neck, what are the major blood vessels and the nervous supply. Now we will directly pass on to the skull. So it is not possible in a single class to describe in detail about the skull. So it requires multiple classes. So I will discuss mainly about the salient features of the skull. So the skull actually can be studied in the form of normas. Normas of the skull means views. So the skull can be studied under 5 views. Norma verticalis, when you look the skull from above, so superior view is called as norma verticalis. Norma frontalis is the anterior view of the skull or the frontal view of the skull, front view. Norma occipitalis is the posterior view of the skull. Then you have norma lateralis is actually the side view of the skull, and then what you have is the norma basalis or the inferior view of the skull. So through these 5 normas, the skull actually can be viewed and the salient features or the important features can be appreciated. Now apart from this, you also remove the calvaria of the skull, then inside you can see the interior of the base of the skull, that is the cranial fossa. Interior of the base of the skull I am not going to deal in this class. So mainly the normas of the skull and the mandible I will be speaking mainly on the salient features. Now what is anatomical position of the skull? So first, to hold the skull in the anatomical position, there is a plane which is called as the Frankfurt's plane. The orbits should be directed to the front and the skull should be laid in such a way that the infraorbital margin or the lower margin of the orbit and the upper margin of the external auditory meatus. The lower margin of the orbit and the upper margin of the auditory meatus should actually pass in a straight line. Okay, it should lie in the same horizontal plane, and that is called as the Frankfurt's plane. So this is universally accepted as the anatomical position of the skull. So the skull is actually studied and appreciated by holding in the Frankfurt's plane. So the first norma which we are actually going to discuss is the norma verticalis. So what are all the bones will we see in the norma verticalis? Norma verticalis is actually a viewing the skull from above or the superior view. Mainly you see the frontal bone. Then you see behind the frontal bone, what you see is the parietal bones. So the 2 parietal bones you are able to see here. Then you are able to see the occipital bone. Okay, so frontal bone, a pair of parietal bones, and occipital bone you are able to see in the norma verticalis. Not only that, more laterally you are able to see part of temporal bone. Okay, so temporal bone also you can see, and very carefully if you observe, the part of the greater wing of sphenoid can also be seen, but not very clearly. Mainly frontal, parietal, temporal and occipital bones you can see. Okay. Now, certain sutures you are able to see. One suture which you come across is the sagittal suture. So the sagittal section of the body which divides the body into two equal halves or sagittal plane. So since it is present in that plane, it is called as the sagittal suture, which is present in between the two parietal bones. Then the suture which is present between the parietal and the frontal bone is actually called as the coronal suture. Again, it lies in the coronal plane. Okay, coronal suture. So this is the coronal suture, and this is actually the sagittal suture. Behind, you are able to see another suture which is roughly triangular, and it represents the symbol lambda. So that is why it is actually called as the lambdoid suture. Okay. So coronal suture, sagittal suture, and lambdoid suture. The meeting point of the coronal suture and the sagittal suture is actually called as the bregma. So the bregma is the meeting point of the coronal suture and the sagittal suture. That is actually called as the bregma. So in the fetus, it represents, or the neonatal skull, you can see this part is not ossified and it represents anterior fontanelle. So I will come to what is the fontanelle at the end of this session, okay, while describing the neonatal skull. So that is actually called as the bregma. Then the meeting point of the sagittal suture and the lambdoid suture is actually called as the lambda. As I told you, it represents the symbol lambda. Again, here also it represents in the fetal skull and the neonatal skull, you can see a membrane which is not fused and called as the posterior fontanelle. Okay, you can see the bregma and then you are able to see the lambda. What other features you can come across? Metoipic suture, not usually found, but in some skulls you can see a line in the center of the frontal bone. It represents the persistent suture of the frontal bone. So two frontal bones, they fuse into one single bone. Okay, but if sometimes you can see a suture, a remnant of the suture which you can see the line of fusion as the metoipic suture, a line, vertical line at the center of the frontal bone is the metoipic suture. Then you are able to see a parietal foramen on either side. So these are the parietal foramens. The parietal foramen transmits emissary veins. So emissary veins are the veins which connect the extracranial veins outside the skull to the intracranial, inside the skull, dural venous sinuses. So this mainly connects the superior sagittal sinus inside the skull with the extracranial veins. So they mainly help to regulate the intracranial pressure. Okay, so parietal foramen, you can see that. And the most prominent part of the parietal bone is called as the parietal prominence or the parietal tuber. Parietal prominence or the parietal tuber, the most prominent part, and deep to the parietal prominence or the tuber, you see the posterior ramus of lateral sulcus. So the upturned, the posterior ramus of lateral sulcus, you can see that, and it corresponds to one area, the Wernicke's speech area, the Broadback's area. The Wernicke's speech area corresponds to that, okay, near the supramarginal gyrus. So that is the importance of the parietal tuber. Then what is vertex of the skull? The highest point of the skull is actually called as the vertex of the skull. So it is present 2 to 3 centimeters behind the bregma, and it is actually called as the vertex of the skull. Vertex of the skull is the highest point of the skull. So that is some of the salient features which you come across in the Norma Verticals. Next, we will move on to the Norma Frontalis. So first, let us try to understand what are all the bones which you can see in the Norma Frontalis. You are able to see the squamous part of the frontal bone. Okay, squamous part of the frontal bone you are able to see here. Then next large bone which you are able to see here is the maxilla. So you are able to see the maxilla, the body of the maxilla you are able to see, and the maxilla has got 4 processes. The most prominent you are able to see the alveolar process, that is the socket for the teeth, upper jaw, the body. Okay, maxilla has got a body, the alveolar process. Okay, then the maxilla has got frontal process. So this is actually the frontal process of the maxilla. Then one more process goes into the orbit, and that is called as the orbital process. Okay, which forms the floor of the orbit. Then you have the zygomatic process. Okay, the zygomatic process articulates with the zygomatic bone. Zygomatic process. Then one more process which is not seen here is the palatine process, which forms or take part in the formation of the hard palate, your palate bone, the bone which forms the roof of the mouth or the floor of the nasal cavity. Okay, so that is in short about the maxilla. Body of the maxilla you have the alveolar process, zygomatic process, frontal process, and then the palatine process. Palatine process can be viewed on the inferior surface. The body has a large air-filled space which is actually called as the maxillary air sinus. So it is an example of pneumatic bone. Then the next bone you are able to see here is the nasal bone. The nasal bones articulate in the center by the internasal suture, and it articulates with the nasal process of the frontal bone, forming the frontonasal suture. Okay, the internasal suture, and this is the frontonasal suture. Articulation between the frontal and the nasal bones. You are able to see that. Then what else you are able to see is the zygomatic bone. So the zygomatic bone mainly forms the prominence of your cheek, and that is actually called as the malar prominence. Okay, it is called as the malar prominence. Again, it has got a maxillary process which articulates with the maxilla. Then it has got a frontal process through which it articulates with the zygomatic process of the frontal bone. Then it has got a temporal process which articulates with the similar process of the temporal bone to form the zygomatic arch. Okay, so again the zygomatic arch can be viewed better from the lateral aspect. So since there are lot of features which has to be described, so I will be going in a bit fast pace, otherwise it is impossible to cover even the salient features in a single class. So what I recommend you is the video. Actually what happens is you can download the video and then you can view the video at many number of times as possible. So you can pause, you can take notes, then you can, what happens, you can replay. So thereby what happens is you will be able to understand all the features. So that is about the zygomatic bone, frontal process, maxillary process, and then you have the temporal process. Okay, the zygomatic bone. Okay, then nasal bone we have seen, then maxilla we have seen, zygomatic, and then mandible is again a single bone. So I will again come to the mandible or the lower jaw later. So the most prominent part is actually the frontal tuber. You are able to see the frontal tuber. The squamous part, what happens? It forms a margin which is actually called as the supraorbital margin. So this is actually called as the supraorbital margin. Medial part, the margin is actually indented by a notch, or sometimes the notch becomes a round foramen which is called as the supraorbital foramen. The supraorbital foramen transmits the nerves and vessels of the same name, supraorbital foramen. Medial to that we have supratrochlear vessels and the nerves. From the supraorbital margin, the frontal bone actually passes behind as the orbital process. Okay, so by that behind it forms the orbital process. Now, the junction in the midline of the frontonasal and the internasal suture, this point is actually called as the glabella. Okay, This is actually called as the glabella. Now, above the glabella, then and above the supraorbital margin, again you see a raised area which is actually called as the superciliary arch. So, superciliary arch is the area where our eyebrows are present, and it is most prominent in males. Above the supraorbital margin, you see the superciliary arch. So, nasion is actually the root of the nose. So, nasion is the point where you are able to see, that is the junction of these frontonasal and internasal suture is actually called as the nasion. And here you have the glabella, and above the supraorbital margin you see the superciliary arches. Then any other foramen you come across in the maxilla, again below the inferior or margin of the orbit you see the infraorbital margin, which transmits the nerves and vessels of the same name. So that is the infraorbital vessels and nerves. So here one interesting point you can see: supraorbital foramen, infraorbital foramen, mental foramen. All three foramens lie in a same straight line, and from this the branch is from ophthalmic division of trigeminal nerve. Infraorbital nerve is actually from the maxillary division of trigeminal nerve, and from the mental foramen, mental nerve is from the mandibular division of the trigeminal nerve. One more foramen you see here, this is actually called as the zygomatico-facial foramen. So, supraorbital foramen, then you saw the infraorbital foramen, then here the zygomatico-facial foramen, again which transmits the nerve of the same name, zygomatico-facial nerve. Okay, then what else you come across? The large opening you are able to see here, that is actually called as the anterior nasal aperture or the piriform aperture. Anterior nasal aperture or piriform aperture, which is mainly formed by the two notches of the body of the maxilla coming together. Okay, the anterior nasal aperture, and here where they meet the midline inferiorly lower border, you see the anterior nasal spine. The anterior nasal spine gives attachment to the nasal septum. The cartilage part of the nasal septum is attached to the anterior nasal spine. Then this is part of the nasal septum, bony septum, that is the vomer. The vomer bone you can see here. Okay. Then these projections of the nasal concha, the largest one is the inferior nasal concha. So here you are able to see the cavity of the orbit. So orbit is again bony orbit, we will be dealing it separately, but the margins, the superior margin is mainly formed by the frontal bone. Okay. The lateral margin is actually formed by the frontal and the zygomatic bone. The inferior margin is mainly formed by the maxilla and part of the zygomatic bone, and the medial margin is mainly formed again by the part of the maxilla, frontal and the lacrimal bone. Okay. So that is the margins of the orbit. Then above the canine tooth, you are able to see an elevation which is actually called as the Canine Eminence. This is actually called as the Canine Eminence, and the medial to that you have the canine fossa. Same way you also have above the incisor teeth, the incisive fossa can also be seen in the Norma frontalis. So infraorbital foramen I have already described to you. So zygomatic bone, as I told you, which forms the malar prominence or the prominence of the cheek. Temporal process is of the zygomatic bone, which joins with the zygomatic process of the temporal bone to form the zygomatic arch. Zygomatico-facial foramen, which we have seen, one of the foramens on the face, then body of maxilla, and the processes as I already told you, that is the frontal process, alveolar process, then you have the palatine process, and then you have the zygomatic process, that is the anterior nasal aperture with the anterior nasal spine. So next, moving to the next view is the Norma occipitalis. So the Norma occipitalis is the posterior view of the skull. What are the bones seen in the Norma occipitalis is pair of parietal bones or the occipital bone, and pair of parietal bones we definitely see. So the parietal bones, and mainly you see large part of the squamous part of the occipital bone, parietal bones as I told you, then mastoid part of the temporal bone. Okay, so mastoid part of the temporal bone you are able to see here. This is the squamous part, very small part, squamous part of the temporal bone also you are able to see here. Okay, mastoid process again you are able to see here, and you are also able to see a foramen, that is the mastoid foramen. Again it transmits an emissary vein which connects the sigmoid sinus with the posterior auricular vein, that is the mastoid emissary vein. So mainly large squamous part of occipital bone you are seeing here, parietal bone separated by the lambdoid suture. Sometimes what happens is the suture might not fuse, the lambda might not fuse. If it is not fused, then you will be able to see a separate bone there, which is actually called as the intraparietal bone. Okay, a separate bone there you can come across in some skulls, which is actually called as the intraparietal bone. Okay, so this is the lambda, the meeting point of the sagittal suture and the lambdoid suture. Then what are all the features? As I told you, lambda, asterion. So here meeting point of three bones, that is the occipital, parietal, mastoid part of the temporal bone. So meeting point or the union of the three bones is actually called as the asterion, and again in the fetal or neonatal skull, that is the position of the posterolateral fontanelles. Okay, so there are one anterior fontanelle, one posterior fontanelle, a pair of posterolateral fontanelles on the either side. That is the mastoid foramen, and that is the mastoid process for you. So this mastoid bone completely is a part of temporal bone. Okay. Then you are able to see a very prominent structure which is called as the external occipital protuberance. If you trace the external occipital protuberance, laterally it continues as the superior nuchal line. So that is the superior nuchal line. So the superior nuchal line is the demarcation of the occipital bone. The above part actually ossifies by membrane, whereas the part below that ossifies by cartilaginous. So it is endochondral ossification because it is mainly forming or taking part in the base of the skull. Above part is actually contributing to the neurocranium, so it is actually membranous type of ossification. So on either side of external occipital protuberance, what you see is the superior nuchal line, which gives attachment to the epicranial aponeurosis and also to your sternocleidomastoid muscle. The most prominent part of the external occipital protuberance is actually called as the inion. The most prominent part is actually called as the inion. Then from the external occipital protuberance, you can see a vertical ridge that is actually called as the external occipital crest. Okay, that is called as the external occipital crest. Now along the external occipital protuberance and external occipital crest, we have the ligamentum nuchae attached to it. The crest extends from the external occipital protuberance to the posterior margin of foramen magnum, attaches to the posterior margin of the foramen magnum. On the midway between the external occipital crest, on either side you can see another pair of lines extending laterally, that is called as the inferior nuchal line. Okay, this is called as the inferior nuchal line, whereas above the superior nuchal line you see a faint ridge that is actually called as the highest nuchal line or supreme nuchal line. It gives attachment to the your gallia aponeurotica and occipital belly of the occipitofrontalis muscle, that is to the highest nuchal line. This is superior nuchal line and that is your inferior nuchal line. And the most prominent part of external occipital protuberance is the inion, and that is your external occipital crest. So now we will move on to the next view, that is the Norma lateralis. So we are actually looking at the lateral view of the skull. So in the Norma lateralis, what are all the bones you come across? Temporal bone. So most parts of the temporal bone you are able to see here. Squamous part. Then you are able to see the mastoid part, the mastoid process. So here we have seen the asterion, the meeting point of the three bones. So squamous part of temporal bone. Then what you see is the mastoid part of the temporal bone, where the external occipital protuberance is present. That is the tympanic part or the tympanic plane of the temporal bone. One more part which is not seen in this view is the petrous part of the temporal bone. So three parts of the temporal bone mainly you see. Then what other bones you come across? Definitely parietal bone can be seen, frontal bone can be seen, and the greater wing of sphenoid. Okay. So the other bone what you see here is the greater wing of the sphenoid. So other bones, as I told you, frontal, parietal, part of occipital, and then you see the zygomatic bone. So that is the body of the zygomatic bone, which has got a frontal process. Okay. Then you are able to see this is the temporal process of zygomatic bone. The temporal process of zygomatic bone articulates with the zygomatic process of the temporal bone. Both the process unite to form the zygomatic arch. Okay. Then what else you come across in the temporal, in the Norma lateralis? So in the Norma lateralis mainly you come across the temporal fossa. The temporal fossa is mainly limited by the temporal line. So the temporal line actually mainly starts from the frontal bone, then actually divides into superior and inferior temporal line. The superior temporal line fades away, whereas the inferior temporal line becomes continuous with the supramastoid crest. Okay. So it mainly continues with the supramastoid crest. So which encloses the temporal fossa, where the temporalis muscle originates. Okay. Then it also gives attachment to the temporal fascia. So the temporal fascia is also attached to the temporal line. Okay. Then the temporal fossa deep to the zygomatic arch communicates with the infratemporal fossa. Then here, like asterion, more important than the asterion is the pterion, which is the meeting point of four bones. That is your parietal bone, greater wing of sphenoid, frontal bone, and the temporal, squamous part of temporal bone. It's a H-shaped suture, which is actually called as the pterion. So deep to the pterion, you have the anterior division of the middle meningeal vessels. Okay. So mainly the middle meningeal artery. Then you also have the stem of the lateral sulcus of the brain. Okay. The stem of the lateral sulcus of the cerebrum also is present deep to the pterion, which is actually called as the Sylvian fissure. Okay. So that is the importance of the pterion. So the other aspects of the Norma lateralis, as I told you, mainly the zygomatic arch, which is formed by the zygomatic process of temporal bone and the temporal process of zygomatic bone. So this zygomatic arch has got a anterior root and a posterior root. The anterior root is mainly taking part in the formation of the articular fossa for the head of the mandible. So the articular fossa of the head of the mandible articulates here, forming the temporomandibular joint. Then, as I told you, the supramastoid crest, where the inferior temporal line is continuous with the posterior root of the zygomatic arch, supramastoid crest. Then you see the external acoustic meatus, Deep to the meatus, again you see a sulcus called as the tympanic sulcus, where the tympanic membrane will be attached. So the external acoustic meatus is present in the tympanic plate of temporal bone. So here you see a triangle which is called as the suprameatal triangle. Okay. So posterior-superiorly it is formed by the supramastoid crest, antero-inferiorly by the posterior-superior part of the external acoustic meatus, and a tangent which is drawn between these two. You see a triangle, and deep to the triangle the mastoid air cells can be located. Okay. Then of course when you remove the mandible, it will hinder the view. If you remove the mandible, you will be able to see the lateral pterygoid plate. So this part is actually your infratemporal fossa. This is your temporal fossa. You see the lateral pterygoid plate, and this is the posterior surface of body of the maxilla. So between these two you see a fissure which is actually called as the pterygomaxillary fissure. Okay. This bulged part of the body of the maxilla is actually called as the tuberosity of the maxilla. Between the maxilla and the pterygoid plate, the lateral pterygoid plate, you see the pterygomaxillary fissure. If you go deep into the pterygomaxillary fissure, it will lead into a space which is actually called as the pterygopalatine fossa. So that is actually called as the pterygopalatine fossa. Then of course mastoid process you can see, and one more which is not very long here, that is called as the styloid process. So I will discuss the styloid process in the Norma Verticals. Okay. Then here one more small bone also you can see between the lateral pterygoid plate and the maxilla, that is the pyramidal process of the palatine bone, a very small bone which can be seen in this gap. Whereas this fissure is actually called as the pterygomaxillary fissure. So with this, I have actually completed the Norma lateralis. Now we will move on to the next view, which is actually called as the Norma basalis. So the inferior view of the skull is actually called as the Norma basalis, divided into three parts. The anterior part, which is limited by the line drawn along the posterior border of the palate. Then the intermediate part between the posterior border of the palate and anterior margin of Foramen Magnum, you draw a line, that is the intermediate part. Then posterior to the anterior margin of Foramen Magnum, you see that is actually the posterior part of the Norma basalis. So first the anterior part, as I told you, up to the posterior margin of the palate. What are all the features? So mainly what you are able to see here is the hard palate. The bones forming the hard palate are palatine process of the maxilla and the horizontal plate of palatine bone. Palatine process of maxilla and horizontal plate of palatine bone. Their sutures are intermaxillary suture, interpalatine suture, and this is the palatomaxillary suture. So this suture is in the form of a crucifix. So that is why it is actually called as the cruciate suture or cruciform suture. Okay. So then anteriorly the intermaxillary suture, you see an incisive fossa, and on either side you have incisive foramen, through which the nasopalatine nerve will be transmitted from the nasal cavity. Then it is limited palate laterally and anteriorly, it is limited by the alveolar process which bears the sockets for the upper tooth of the upper jaw. Then posteriorly you are able to see the posterior nasal spine, and that is the posterior border of the palate. These openings are posterior nasal apertures. It is also called as the conae or the posterior nasal apertures. So here, as I told you, incisive foramen seen on the incisive fossa. Then you are able to see posteriorly near the molar tooth, medially on the palate, the greater palatine foramen, which transmits the nerves and vessels of the same name, greater palatine foramen. Then You also come across the lesser palatine foramen immediately behind the greater palatine foramen. They are usually 2 in number. They also transmit the vessels and nerves of the same name, greater and lesser palatine foramen. Then of course I have told you about the incisive fossa. So that is about the anterior part of the Norma basalis. Next, coming to the intermediate part. The intermediate part is from the posterior margin of the hot palate to the anterior margin of the foramen magnum. Here the structures are arranged in the midline and on the either side you can see. So in the midline you see the posterior surface of the sphenoid, okay, and anterior to that you see the warmer bone, and the warmer is actually deflecting on either sides, called as the ala of the warmer, okay. So you see the warmer body of the sphenoid and the basilar part of the occipital bone, which is actually called as the basi-occiput. So the basi-occiput here also shows a tubercle in the midline. This tubercle is actually called as the pharyngeal tubercle, okay, through which the uppermost part of the pharynx constrictor muscle, superior constrictor, will attach, and the pharyngo-basilar fascia will also get attached to the pharyngeal tubercle. This is the warmer, which is splitting to form the ala of the warmer, which will receive the rostrum of the sphenoid bone. So you are able to see the under surface of the sphenoid bone. Then on either side you are able to see the medial pterygoid plate, and that is the lateral pterygoid plate. The medial pterygoid plate shows a downward extension, which you are able to see here. That is the pterygoid hamulus. That is called as the pterygoid hamulus. Okay. So through the pterygoid hamulus, what happens is the tensor villi palatini muscle will pass around. The tendon of the tensor villi palatini will pass around that. Okay. So that is the medial pterygoid plate. If you look at the medial pterygoid plate, near to the root, it will split to actually enclose a small fossa, which is called as the scaphoid fossa. So any fossa which is boat shaped is actually called as the scaphoid fossa. Then here laterally what we see is the lateral pterygoid plate. So pterygoid hamulus, as I told you, in the posterior border of the medial pterygoid plate. Then you are able to see the infratemporal surface of the greater wing of the sphenoid. So this is actually called as the infratemporal surface of the greater wing of the sphenoid, and this part is your petrous part of your temporal bone. So that is the petrous part of your temporal bone. In between this petrous part and the infratemporal surface, you see the sulcus tubae. So where the auditory tube will be lodged. Okay. So that is called as the sulcus tubae. Okay. So then what else we come across? Petrous part, as I told you, and here you are able to see the tympanic plate of the temporal bone, external auditory meatus. So here you are able to see the articular fossa, where the head of the mandible will articulate. So this is the tympanic plate of temporal bone. Articular fossa has got a posterior non-articular part formed by the tympanic plate, and then you have the anterior articular part. This is actually called as the articular tubercle. Okay, so this part is actually called as the articular tubercle. Okay, then what are all the structures you come across in the Norma basalis? In the intermediate part, some of the foramens we will see now. In the infratemporal surface of the greater wing of the sphenoid, mainly you come across foramen ovale. So this is oval shaped foramen, which is called as the foramen ovale, which transmits the mandibular nerve and other structures. So emissary vein, accessory middle meningeal artery, and the lesser petrosal nerve. So as for now, remember foramen ovale, which transmits the mandibular nerve. Behind that one small foramen you see here, that is actually called as the foramen spinosum. So that is the foramen spinosum. Here you are able to see that, which actually transmits nervous spinosum and middle meningeal artery. Okay, foramen spinosum. Then near to the foramen spinosum you come across a small spine-like structure, which is actually called as the spine of sphenoid. So the spine of sphenoid here will give attachment to the spinomandibular ligament and the anterior ligament of malleus. So these two main ligaments are actually attached to the spine of sphenoid. Foramen ovale, foramen spinosum, and spine of sphenoid. Then one more foramen you come across. This is actually called as the foramen Lyserum. The name itself is actually called as Lyserum because the margins are lacerated or cut like that, irregular. That is why it is actually called as the foramen Lyserum. It is present between the petrous part of the temporal bone and the basilar part of the occiput. Basilar part of the occipital bone. It is actually not at all a foramen. It is a gap. Okay, so it is a gap, and in the foramen you will see it will receive the opening of the anterior end of this canal. You see here the carotid canal. So the carotid canal lower opening is here. Upper opening can be seen in the posterior part of the foramen Lyserum. So you should imagine the carotid canal as L shape. Okay. So carotid canal, I will come to the posterior aspect. So mainly you come across the foramen Lyserum, and here you are able to see the carotid canal, which transmits the internal carotid artery and sympathetic plexus. So the internal carotid artery will enter vertically, and then it will turn like this transversely, and then it will pass through the foramen Lyserum. So carotid canal has two openings. Lower opening is here, and the upper opening is seen in the posterior part of the foramen Lyserum, the carotid canal, which transmits the internal carotid artery. So next, coming to the posterior part, the posterior 1/3 we have come here. And the posterior 1/3 mainly consists of a large foramen that is actually called as the foramen magnum. So this large foramen you see here, that is the foramen magnum. And then you see the occipital bone, squamous part, you are able to see the occipital bone. Then you are able to see the mastoid process. Then condylar part of the occipital bone, two occipital condyles through which it will articulate with the atlas vertebra, forming the atlanto-occipital joint, the joint between your head and the cervical vertebra or the neck is actually called as the atlanto-occipital joint. So this large foramen or the foramen magnum is transmitting so many vital structures, which can be divided structures in the anterior part and structures in the posterior part, and that anterior and posterior is divided by the alar ligament. Okay, so in the anterior part you have apical ligament of dens, cruciate ligament, and membrana tectoria. So mostly the ligamental structures. So they are all the ligaments which is involved with the joints. So from the second and the first cervical vertebra, apical ligament of dens is actually from the dens of the axis vertebra. Then you have the cruciate and the membrana tectoria. Posterior part of the foramen ligament mainly transmits the vascular and the nervous structures. The lower part of the medulla oblongata. Don't tell spinal cord. The lower part of the medulla oblongata. Then the spinal part of accessory nerve. Then the fourth part of vertebral artery will go inside. So two vertebral arteries will actually enter inside. Then after the union of the vertebral artery, what happens is the vertebral artery will give two arteries, that is the anterior and posterior spinal arteries, which will again come out of the vertebral canal. So anterior and posterior spinal arteries, fourth part of vertebral artery, then the lower part of medulla with its meninges and the spinal accessory nerve are the structures which is passing through the foramen magnum. Then on either side, what else you come across is the, in front of the occipital condyles you see the anterior condylar canal or hypoglossal canal, which transmits the hypoglossal nerve or the 12th cranial nerve. Then posterior condylar canal transmits the emissary veins. Then on either side you see the jugular foramen. Okay, so the jugular foramen, there also you have a fossa which is called as the jugular fossa, which rests the inferior bulb of the internal jugular vein. So the bulb has got two bulbs, superior bulb and the inferior bulb of the internal jugular vein. What are the structures transmitted to the jugular foramen? 9th, 10th and the 11th cranial nerves it mainly transmits. Jugular Foramen transmits the 9th, 10th and the 11th cranial nerves, glossopharyngeal, vagus and the accessory nerve. Then it transmits the internal jugular vein. Then it also transmits the inferior petrosal sinus. Inferior petrosal sinus will come out of the foramen and then it will join the jugular foramen. So then you come across the styloid process. So styloid process mainly receives muscles, 3 muscles and 2 ligaments which forms the styloid apparatus. Then you see the mastoid process. Medial side you see the mastoid groove through which the posterior belly of digastric will attach, and this groove for the occipital artery. Between the styloid process and the mastoid process, you have the stylomastoid foramen through which the facial nerve emerges from the skull. Okay, stylomastoid foramen through which the facial nerve emerges out of the skull. Okay. So next, coming to very short description about the mandible. So the mandible is also called as the lower jaw. It consists of a body of the mandible, so which is united in the center by the joint symphysis menti. Okay, the right and left halves are united by the symphysis menti. That is the joint in the midline. Now it is actually called as the mental protuberance. So that joint after fuse, it is actually called as the mental protuberance, the point of fusion. So each half has got a body and then you have a ramus of the mandible. So the body has got an upper border which is marked by the alveolar process, the sockets for the teeth of the lower jaw. Then this lower border is actually called as the base of the mandible. The lower border is actually called as the base of the mandible. In between the upper border and lower border, what you see here is the mental foramen which transmits the mental nerve. External surface as the mental foramen which transmits the mental nerve. Inner surface, mainly you are able to see 4 prominences. They are actually called as the genial tubercles. A pair of superior genial tubercle, a pair of inferior genial tubercles. Again for muscle attachments, geniohyoid muscle and genioglossus muscle. Then you are able to see an oblique line which is actually called as the mylohyoid line, which extends up to the molar tooth. So this divides the inner surface of the body above for the sublingual fossa. The sublingual salivary gland is present here, and below the submandibular fossa, the submandibular gland actually partly rests on this submandibular fossa. So here also you see another depressed area which is actually called as the digastric fossa for the anterior belly of the digastric muscle can be seen. So the mylohyoid line, the mylohyoid muscle will originate, and more posteriorly the superior constrictor muscle of the pharynx also originates. Okay, then above near to the molar teeth, mucous membrane, the lingual nerve will come in close approximation to the mandible. So lingual nerve will be related here. Then mylohyoid nerve, in the mylohyoid groove you can see this is the mandibular foramen through which the inferior alveolar nerve passes. Inferior alveolar nerve passes through the mandibular foramen. That is guarded by a pair of bone which is actually called as the lingula. The lingula gives attachment for the spinomandibular ligament. Okay, so it also gives attachment for the spinomandibular ligament. So genial tubercles I have shown you that this is actually the mylohyoid line. Next, coming to the ramus of the mandible, somewhat quadrilateral in shape, you are able to see. So it has got an anterior border, then it has got a posterior border. The posterior border and the inferior border of the body, base of the mandible, meets to form the angle of the mandible, which is 110 degrees in case of the adults. In children, the angle is actually around 140 degrees, or it is an obtuse angle. Okay, angle of the mandible. Then it has got a superior border which is notched, and it is called as the mandibular notch. In front of the superior border, what you see is the coronoid process. The coronoid process receives the insertion of the temporalis muscle. Then posterior part of the mandibular notch, what you see is the condyloid process. The upper surface articulates with the The upper surface articulates with the articular fossa forming the temporomandibular joint. Then you have short constriction called as the neck of the mandible. The neck of the mandible receives the insertion of the lateral pterygoid muscle. Okay. Then there is the posterior border, which again will receive the ligaments of the temporomandibular joint, the lateral ligament. Angle of the mandible will receive the insertion of the stylomandibular ligament, which is a modification of the deep cervical fascia. The lateral surface is rough, mainly for the attachment of the muscle, mainly the masseter muscle. Okay, rough impressions you can see here, mainly for the masseter muscle attaches to the lateral surface. Medial surface of the mandible, the medial pterygoid muscle is attached to the angle medial surface. So lingular and mandibular foramen already I have showed you. So that is the mandibular foramen, which is guarded by a bar of bone, which is the lingula. Then the coronoid process I told you, which gives attachment to the tendon of the temporalis muscle, and this is the condyloid process. This is the mandibular notch. Again, one nerve is related to the mandibular notch, that is the masseteric nerve. Same way, in the neck of the mandible, the auriculotemporal nerve passes close to the medial surface of the neck. So, auriculotemporal nerve, here you have masseteric nerve, you have mylohyoid nerve, you have lingual nerve, you have mental nerve, you have here, and the inferior alveolar nerve. Then, other features, condyloid process as an articular head and neck, then the mandibular notch, as I told you, which is related to the masseteric nerve. So, angle is by the meeting of the posterior border of the mandible and the inferior border or the base of the mandible. The angle is approximately 110 degrees. In children, it is 140 degrees. Finally, coming to the neonatal skull. If you look at the neonatal skull, the facial skeleton is very small and rudimentary. It is not developed, whereas the neurocranium is large, and you can see certain unossified membranous areas. They are called as the fontanelles. Okay, so it is only 1/7 of the size of your neurocranium or the cranium or the head. That is the facial skeleton, rudimentary. The maxillary sinus are all still not developed, the frontonasal sinuses. The mandible is also very small and rudimentary. As I told you, maxillary sinus is not developed. So, edentulous, no eruption of the teeth takes place. So, that is why all the alveolar processes are all very rudimentary. And the angle of mandible, you are able to see it is an obtuse 140 degrees. So, the vault of the skull has fontanelle. So, here you are able to see anterior fontanelle, posterior fontanelle, and then you are able to see the anterolateral and posterolateral fontanelles. So, if you look carefully, the fontanelles are all related to the angle of the parietal bones. Parietal bone is antero-superior, antero-inferior angle, posterior-superior and posterior-inferior angle. Okay. So, that is how you can identify the antero-inferior angle also as a small extension like thing. Based on that, you can also identify the side of the parietal bone. Okay. So, anterior fontanelle, mainly these fontanelles they close around by the 3 to 6 months, but anterior fontanelle takes about 18 months to 2 years to close. Now, why actually these fontanelles are present? Because when the head has to pass through the birth canal during the labor or childbirth, it allows the overlapping of the bones, so flexibility of the bones. Now, this anterior fontanelle is also of clinical importance because intracranial pressure can also be measured through that, and position of the ventricles of the brain also can be assessed through this anterior fontanelle. It has got a great clinical significance. Okay. So, with that I complete the introduction to the head and neck and also the osteology of the skull. So, thank you very much.